Hello, my name is Dr. Jim Edwards, and I am a psychiatrist in Gulf Shores, Alabama. And most of my practice life I've spent up in Connecticut, where I had the opportunity to work with some major national psychiatric associations and study some of the ideas around financing healthcare, which are particularly appropriate right now, I do believe, as it is in the forefront that we're also working on tax issues. I believe that one of the best ways to finance healthcare is through the tax system. Let me tell you why. The HSA, or Health Savings Account, is a one-year trust, and it's part of the tax system in that those monies after 1 year saved in the account can be rolled to your IRA after 1 year. Now that's fine for those who have jobs and income, but my idea was to look at what the Congressional Budget Office did when it studied these accounts, and they studied them using accounts which were not post-tax, they were pre-tax, so individuals had to use their own money to get them. Now we have the idea of the refundable tax credit. I do believe that these linked together in a 3 to 5 year trust would function much better, as a large CD almost, to help the country with its healthcare financing issue, which is one of the sticking points to any kind of healthcare bill. You know, we do need to have some fiscal responsibility, and one of the ways that this can be created is to enlist the services of the 50 major medical carriers who have been carrying major medical policies in the United States for years. They have great experience. These policies are cost effective, they're low cost in general compared to what we're doing today, where, for example, a family of 4 spends $16,000 a year with an HMO in the Northeast. Doesn't always work when it comes time to have real health care. Insurance tends to work much better. I do believe that insurance is the way to go. Insurance began in healthcare with the Sisters of Mercy and the Blues when it was mutual insurance. That's quite a while back now, and things have gotten more complicated, but the price has gone up. It's gone up fairly astronomically. Now, for a family of 4, a policy, a major medical policy, is somewhere in the neighborhood of $3,500 a year. Now, when you think of it, you've got $3,500 a year in your HSA, which is a tax account or a checking account that you have at your bank. And that can roll to your IRA at the end of the year. That's fine if you have the jobs and income, and it will work for you in a 1 year trust. I like to call what I'm calling an MIT, a medical insurance trust, which is basically a longer term trust, not just an HSA. These accounts, refundable, can work for everybody. Everybody can have one as a basic layer of health insurance in every state. And you don't have to have one just because you live and breathe and you were born in the United States. But if you do seek health care in a state, I think it's much better that there is a policy in a state, for example, to say, well, you should join up with our healthcare HSA, or MIT as I call it. You simply register, you get a card, and you begin paying in the tax system. This helps the tax system, and it helps the healthcare system. What are the benefits? Well, it builds the health and wealth of families. It covers Medicaid from day one. Guess what? After 3 to 5 years, it can cover lots of other things. It can cover research. It can cover the unfunded liabilities that we have going forward. It prevents the country from going bankrupt, and it prevents individuals from going bankrupt because of any healthcare need. Major medical policies tend to be in the area of $1 million to $3 million a year, and what they cover for a family or an individual. That's great. When you think about it, Bill Clinton's consultant on this, Our Magaziner, said that an average person, when Bill Clinton was first running, spent about $1,000 a year on health care of any kind. So guess what? Going forward, we're not spending a whole lot more probably. Don't know. Doesn't matter. this can all be absorbed in what we're talking about. And the money involved is more than enough to cover these items. Going forward, we have to look at the portability of things, which is an advantage of these accounts. They also create tax fairness, whereas now, someone working for a company that has 50 or more employees might be given health care from the companies, given, so to speak, but the government has to subsidize a lot of these things. Guess what? When you give something, you have to pay for it. And the government would have to lose about 6% of its tax base, according to the studies of the CBO. Yet, when you think of the 15% that businesses have to fork out for these policies for their employees every year, we're also spending a lot of money on it. And it's not quite necessary to spend quite so much money. I think what we need to do is have a basic system that works for everybody. It keeps people from going bankrupt. It also keeps the country from going bankrupt. And it insures individuals and families up to probably $3 million a year or more. So if every state regulated what could be on the market in that state as a layer, first layer, for any kind of health insurance policy, this would work to fix the system. There are many advantages. It creates a better relationship between the doctor and the patient. The patient chooses what to do with those monies in their health savings account or their MITs. When the monies are spent out of those, it can be tax deductible. When it's renewable, the same thing occurs the next year, and the person or the individual family gets what's called a refundable tax credit going forward. There are approximately, let's say, 20 million people who don't have health care in the United States. This could be covered by these type of accounts. There are also issues in terms of actuary, which is contained in the CBO studies, which is not frequently a part of the debates that we see. Most of it's done behind closed doors. We don't really know what's going on in terms of actuary, what's being presented in terms of actuary. Actuary is fundamental to these kind of debates. Let's make America great again. I support you, Mr. Trump. I do believe that the conservatives in the Freedom Caucus have a fiscal idea, which is to have sound money and to have sound health care policies going forward. Let's make America great again. Let's make America healthy again. Let's make this simpler for everybody. I do want to say a few more things. It establishes universal access. For example, someone could sign up at a doctor's office. They could sign up at an emergency room. And I really think I would like to tell you that I've talked to actuaries about this, and I have, and they tell me this will work. They've also told me that they have a very powerful SimuCare model at Milliman and Robertson, which is the main healthcare actuary in the United States. This SimuCare model can do what's called a windscreen study of this for about $12,000. They have lots of data. They can do it. We can too. We can put a man on the moon. And I think, as a psychiatrist, we can shrink this down to size so that, comment on Medicare, these accounts pooled out to 5 to 7 years would have a significant impact on the financing of Medicare. The Medicare actuary makes approximately 2% on its money and goes to the House and Senate for appropriations every so often. This pool could function to do much of that work without the necessary requests of the House and Senate. Secondly, I would like to add some credit to Mark Litow, who did the original study recognized by the CBO. And the study was entitled "The Impact of Health Savings Accounts or Medical Savings Accounts on Healthcare and the Federal Budget." This will actually work for everyone, but it's not a one-size-fits-all. These are policies which are real, they have a lot of depth, and they can help us. Let's really look at doing this.